Okay, guys, sorry for the glitch in the glitch. Dr. Williams will be coming on now. Okay, okay. Please accept it. Accept. What's going on? Right. Okay, let's see. Go live. So I do not know what is going on today, but okay. Invite and go live with Dr. Destiny. Okay.
All right, we are on.
Oh my
Hold
God.
on. I was like, send request. Oh my goodness. How
Oh
are
my
you?
God. I'm good. I'm so sorry for the misinformation, Abby. I
No,
don't know what to say.
no, I
We had
apologize.
two people online and I think it had to log me out when I called you.
Oh,
And
oh, I
hopefully,
see.
yeah, that's
Okay,
fine.
got
Are
it.
you ready?
Yes, I am ready.
Are you sure?
I'm positive.
So we're just going to be talking like our topic today. We're just going to be talking about the importance of, the thyroid hormone, the thyroid gland as a whole, with hair loss. I mean, it's just for you to kind of, educate us a little bit because I know that is part of what you do. So I want you to kind of educate us. But before we go, you have to, tell our audience who you are, where we can find you and all that.
Yes. So I am Dr. Williams, Dr. Not Miss, and I am a family medicine physician board certified. And I have a private practice called Gateway Direct Health, which is a membership practice, a concierge direct primary care practice. And we are doing healthcare different and providing care the way that people need it and want it, right? They want to have a doctor that knows them and understands who they are and listens to them. And so that's the kind of care that we give at Gateway. And we're really big on education. So we love doing lives like this so
Hmm.
that we can let people know more about, like the ins and outs of their body, right? And give them the right education and information so that they can make decisions.
Okay. So when you say you're doing medicine a different way, what do you mean by that?
Yeah,
So that
so
we can
we're not
understand.
doing we're not doing traditional healthcare where people, the doctor's seeing 25 patients a day and everyone's waiting hours in order to see the doctor, or they're waiting months for an appointment. With our
Okay.
membership, our members pay a monthly membership fee and I'm their personal doctor. So they get appointments within days. They have someone who's going to spend time with them, 30, 45-minute appointments.
Okay.
So we're really big on education and lifestyle. We're not just prescribing pills only and not letting people know what they can do about their own health. So
Okay.
that's how we're doing it different. Yes.
So it's a membership based practice. And this is very important because people have to understand that it's good to have access to your doctor, someone that can sit down and talk to you
Yes.
and basically go through, because you don't want someone that will rush you 10 minutes, you know, rush you out of your appointment, and you
Right.
find out, because I tend to talk to clients or patients, And
Yeah.
they'll say that I don't remember my doctor talking about that. I don't remember my doctor talking about that. But
Yeah.
once I think in your practice, what I'm trying to understand is that you take your time with each client. And I think that's the benefit of that. Okay, good. So do they like the membership? Is it like monthly or how does
Yeah.
it work? Is it how does it work?
Sure, it's a monthly or annual membership fee, and
Okay.
that covers their visits with us. So there's no copay, no deductible.
Awesome.
Like the membership fee covers their whole visit. And most people are like, well, if I have insurance, then I can't join. But that's not true. Most of the people in our practice have insurance. We use it for their medications, their labs, referrals to specialists. Um,
Okay.
but I just don't get paid by it. I don't bill insurance, but most people have insurance and just want that level of care that they can't get anywhere else, where they know their doctor knows them and spends time, quality time with them, explaining things, not just saying, hey, I'm gonna give you a medicine and don't explain what the medicine is for. What are the side effects? I think that type of care has not done anyone justice, and we want to provide the right level of care for people.
So you're trying to tell me even if I have insurance or if I don't have insurance,
Mm-hmm.
everyone qualifies to be part of your membership.
Absolutely. Whether you have
Awesome.
insurance or not, yes.
Awesome. So there's no longer excuse for people saying, I haven't seen a doctor in 5 years.
Right.
So there's no excuse for that.
Absolutely. Exactly.
Okay, so they are listening now.
Yes.
There's no excuse for after this discussion we're having today. And if you know that this is pertains to you, you've never had a regular checkup. Some people say, I've not seen a doctor in 5 years. So there's no excuse at all.
Exactly.
Because Dr.
Exactly.
Williams is telling us now that her practice is a membership-based practice.
Yes.
And so someone is saying, can I use my HSA?
Of course you can. You can use
Oh,
your
wow.
HSA. Yes, we accept that. You can also, if you wanted to submit let's say you wanted to submit to insurance, we do super bills. So if you want to get some reimbursement through your insurance, we can do that. But yes, you
Awesome.
can use HSA.
Wow. That is fantastic. That is fantastic. It's almost like VIP, but not VIP. Almost like a celebrity-based clinic. I mean, that's
Yes,
fancy. I mean, I
yes,
don't mind. So that means that if I can't see my doctor, I can basically sign up with
yeah,
you and see you, whatever I need. Instead of waiting on my doctor, waiting on appointments. Okay. And how soon can the
absolutely.
person see you? How soon can the person see you?
So
Like,
if
if
it's
we're
an urgent, same day. And if
Mhm.
it's like routine, within a few days, within a few days. But it's
Okay.
still like we want to get people in when they need to within a week.
Okay.
But we do, of course, do our 3 month follow ups and our annual physicals, all of that stuff. But we're just available if they need us sooner.
Okay. So where is your clinic located?
It is in Stockbridge, so that is in South Atlanta.
South Atlanta. Okay. So anyone that's looking for you, South Atlanta.
Yes. Oh,
Okay. We'll still talk
I
about.
also do telemedicine and home visits, so I'm happy to come to them.
Oh, wow. Okay. That would be good. So everyone, you listening to it. I don't want no excuses now, because when you come to see me, I'm going to refer you back to Dr. Williams. That's it. That's it. That's it. I'm not even. There's no negotiation. If you haven't had a physical, I'm not doing it.
Right, right,
Okay.
right.
So today, I mean, the reason for this lecture today or talk today or conversation today is more to educate people for them to understand how every disease process is kind of related.
Mm.
Okay. So how often do you see hair loss, like in your practice or with experience? Like how often do you see hair loss?
Hair loss is very common,
Mm,
right? So we see that when people are on our medications, because we know that medications can have that side effect of hair loss.
that's right.
We know people with thyroid disease can have hair loss. We've seen people with traction alopecia where they've had really tight
Yeah.
hairstyles, or have had it in the same place and has led to chronic hair loss. Female and male pattern baldness.
Mm-hmm.
Um, Something else I was thinking about. But yes, we see that often. Oh yeah, if they're like seborrheic dermatitis is really bad,
Yes.
or stuff
Mm-hmm.
like that, we see it's a common issue that people go through.
So can you give us a little bit with hair loss? You always check their thyroid, or you kind of they have to give you other symptoms before you go ahead and check the thyroid. Or checking the thyroid is part of the routine yearly checkup. I just want to make sure like people understand like is it a yearly thing
Yeah.
or it's only when someone presents with something that you cannot check it.
Yes. So traditionally, we check thyroid if there are symptoms suggestive of hypothyroid, meaning that your thyroid is not functioning well, or at the right level, is functioning lower. And then there's hyperthyroid, where it's super functioning, right, and is
Okay.
doing too much
Okay.
and producing too much thyroid. But now we're seeing that more and more clinicians are including TSH, or the thyroid stimulating hormone, in the annual labs. So
Okay.
we do both, yeah, if depending on what the patient or our members want.
I want it.
Um, but typically with hair loss, we will check for thyroid, especially in women. Not so much men, as we know thyroid disease is more
Mm-hmm.
prominent prevalent in women.
Mm-hmm.
But we do check thyroid disease in the workup of hair loss.
Okay, so for us to just backtrack a little bit for people who are just joining, we're trying to well, the conversation today is about hair loss and thyroid disease. So can you educate us a little bit? Like, people don't really know what is the thyroid. This crazy thing we're talking about. What is thyroid? Like,
Right.
what is it? This is the first
I
time
know.
I'm hearing about thyroid.
Yeah, because I know hormones are really big, right? Like
Yes.
our hormone balance. So a
Yes.
thyroid
Yes.
is a gland that sits at the right in front of our breathing tube, called the trachea, and it
Mhm.
helps to regulate metabolism. It helps to regulate our metabolic rate. So when we see that people have low functioning thyroid, they tend to be fatigued, they tend to have weight gain, swelling,
Oh, wow.
hair loss. And then hyperthyroid with super functioning, we see that people are losing weight, they have
Mm.
palpitation, their heart rate is kind of in overdrive, so their heart rate is high, the blood pressure is higher, the heart, palpitations feel like their heart is racing. And so that's what we see with thyroid. It helps to regulate our metabolism.
So you're trying to say, so I'm going to relate this thyroid now. So you're trying to tell me that the thyroid gland can be bipolar. Is that what you're saying?
That's hilarious. I've never heard that before. Well, that's funny.
I mean, I
Well,
mean, that's what you're trying to say. So it can be high. That means it can go
yes,
crazy, or it can be
exactly.
low. That means it can be
Absolutely.
depressed.
Yes,
So
yes, exactly.
when it's really high, what are the symptoms that someone should be looking out for and that they should be concerned about?
Yeah, if they're having weight loss
Hmm.
that they can't explain, especially like they're eating normally, right? They're not on a particular diet. They're eating normally, and they're seeing that they're losing weight. If they notice that they're having tremors, so their hand is shaking and not staying still. If
Hmm.
they notice that their heart rate is higher, their blood pressure is higher, those are signs and symptoms suggestive of thyroid disease. And usually, when we are working up weight loss, high blood pressure, tremors, we are checking the thyroid.
They're checking the thyroid. What about in relation to hair? Do you think they're losing hair, their hair is more thinner when their thyroid is acting up, like it's really high?
Yeah.
So,
Oh
okay.
yeah, and we'll also see that with hypothyroid, so low
Hypothyroid.
thyroid as well. Yep.
Okay. Okay. So what about when it's depressed? What symptoms do we usually see in hypothyroidism? That means a depressed state.
Yeah. So we would see weight gain, right?
Hmm.
Swelling, especially of the legs. We notice constipation, right? Things are not moving as well as it should.
Okay.
So when we see people who are obese and have issues with losing weight, we're checking the thyroid.
Okay. So let me bring it home. So you're telling me that if any of my clients come in and say, I'm losing hair, but I'm constipated, so I need to send them back to you.
If you want, that's fine. Listen, we'll do the workup.
So if they
We will
tell
get
me they're losing hair, but they're also losing weight, so I should send them back to you.
1,000%.
So either ways, if they are losing, so not just hair loss, they also have other symptoms that they might not have noticed.
Absolutely, yep. And that's why it's important not just to, yes, you hear like, okay, hair loss, but also asking more questions, asking about history, asking about any related or unrelated symptoms. Do we notice anything that we're like, oh yeah, I've noticed, my blood pressure's been higher lately, and I really don't know why, right? Like we're asking other questions to make sure, hey, could this be related to the thyroid?
So what we're trying to tell us now is that we should just go beyond not just the hair loss. We should always think there might be an underlying issue too,
Yes, I,
especially
I,
for.
I think that makes sense, because especially if there's something that we can do about it, right? If we can
Mhm.
help to stabilize the thyroid, then we should see less hair loss,
Yes.
right? Or we should see that
Hmm.
there should be growth, right? So that's part of the reason, of course, to look for something more serious, of course, but also there are things that we can, if we can get to the underlying issue, that will help
Hmm.
with the symptom of hair loss.
Okay. So you're trying to say now, let's say someone that doesn't have access to you before they come to you and they have like their regular doctor and they're saying they're losing hair and maybe they're losing weight or they're constipated or they're cold, having hot cold, whichever
Yes.
symptoms they're having. How can they express to their doctor like they need their thyroid checked?
Mm.
How can they present that to their doctor? Like, I mean, if their doctor doesn't understand, they can still come to you. Don't forget that. But I'm just trying so that they can understand that
Yeah.
how can they present that to their doctor so that the doctor can understand, like, what they're trying to aim for? Why do they want to check their thyroid? How can they present it to their primary care physician?
I say ask. Ain't nothing wrong
Ask.
with asking.
Okay.
Ain't nothing wrong with asking, especially, you know, there's a lot of, information out there. And again, like what you're trying to do, you're trying to provide the right, correct information.
Okay.
And so take the information, said, okay, let me consider and say, oh, maybe I need to talk with my doctor and ask about the thyroid. What's their opinion on checking my thyroid?
Okay.
Why would they check it and why not? Right? If they say no, I wouldn't recommend it. Okay, why not? What are you
Why not?
thinking? What is
Mm-hmm.
the your other diagnosis that you're thinking about? And it's okay to ask. It's not
Mm-hmm.
disrespectful and it's not undermining the doctor. It's just you're asking questions because you're curious, because this is your life, right? It's happening to
Yeah.
you, and you're like, I want to make sure that I'm getting the best care and the best person to look at what's going on with me.
Okay. So what are the hormones they need to check for? Like if they're going to their doctor now, what are the hormones they need to check for?
Yeah.
Right.
So the most common lab that we do to test or screen for thyroid disease is called TSH, thyroid
TSH.
stimulating hormone.
Okay.
Yeah.
I'm going to put
So
it in the comment section so that people will know TSH. Okay.
that is what the brain releases to control the thyroid. And
Okay.
so it works kind of counterintuitively. If we have someone who has hyperthyroid, right? They're having hyperthyroid symptoms, the brain naturally is trying to regulate it, so it would be down. The TSH would be down because it's like, I'm not trying to stimulate you. I need you to come down, right? And it's getting stimulated through something else, so the TSH will be low. Versus for hypothyroidism, the brain is like, hey, you're not releasing enough thyroid. I'm going to increase how much TSH I'm sending to you. Again, thyroid stimulating hormone.
Okay.
So we would see the TSH is high. So I know that when people probably look at their labs, they're like, I don't understand this. You're saying that I have hypothyroidism, but my TSH is high. But that's the reason. It's because it's the brain trying to regulate the thyroid, and it'll give it more if it's functioning low, or to give it less if it's functioning too high and wants to bring it down.
Got it. So what you're trying to say, as let me bring it back, let me break it down more, is
I
that
love it.
since it's bipolar, so anytime it's acting up, the gland is gonna say, "Hey, calm down." So that's why the TSH will be low. So anytime he's depressed, the gland is gonna say, "Come on, I need you to be happy. I need you to be
Yes.
cheerful." The
Yes.
TSH will be high. Got it. So we need to check the TSH first. So do they check other labs or just the TSH? Is that all we need to know? Just the TSH?
So
Or is there
usually
something else we need to go?
Yeah, so usually the TSH is very sensitive to
Mm-hmm.
the changes in the thyroid. So
Okay.
if there's something abnormal, TSH is usually what's going to point us in the right direction. And
Mm-hmm.
when we do see abnormal TSH levels, we'll also check T4, so the actual thyroid hormone that's produced, as well as T3.
Okay.
And those will
And,
be high according to the symptoms, right? If you're hyperthyroid, those will be high.
okay.
And if you're hypothyroid, those will be low.
That's what
But
we learned.
typically we start with TSH. But if we're concerned, even more concerned, or like, oh man, this really looks like hyperthyroidism, we'll get T4 or T3.
Okay. So for especially for ladies, that their weight is fluctuating. I know my weight keeps fluctuating. So if I'm really concerned if something is going on, so I need to call the attention of my doctor. That's what you're saying. Say, hey doc, can you check my TSH?
Yes.
If I'm losing hair and I'm concerned, and I have any of these symptoms you've mentioned, I need to talk to my primary care doctor to say, hey, at least check my TSH. So that's
Absolutely.
what you're saying. Yes.
Yes. Yeah. And I think
And
it's okay to ask. It's okay to ask.
okay. So you're saying if it's acting up, if it's really high, is there something we can do about it?
Mm.
Is there something that I can take, any herbal medication I can take, or any ointment, or do I need to dance it out? Is there something like? Is there something? I mean, I'm trying to tell you what people are asking me. I'm
I
just
know, I
so.
know, I know. It's
Do I
really
need to
like,
shake it out,
no,
or do I need to add some herbs,
no,
or
no,
do
no.
I need ointment, or mint green,
Oh.
or tea?
So, with thyroid disease, especially hyperthyroid, it can be dangerous, right? Because
Mm,
your heart is working in overdrive.
okay.
So, it needs to be medically treated. And that means taking medication in order to help with the thyroid level.
Okay.
Yeah,
Okay.
so that needs to definitely see a primary care and
And
or
control
endocrinologist and
it.
hormone specialist in order to get it under control. Because again, it is dangerous, right?
Mm,
You're losing too much weight, you're not getting enough calories, you're not getting enough
mhm.
energy. It's going to weigh
Okay.
on you and your body, especially your heart.
Okay.
So
So
yes, there's no natural
no
supplement
natural.
for
But what
hyperthyroid.
about when it's low? Do we
Okay,
still also take medication? So I'm not safe either ways. Do I still take something when it's low?
that's hilarious. So, I mean, you're saying it exactly like how people. You're right. You're right. Hypothyroidism. So that can be dangerous as well. There's you could go into a coma really, but that's rare. Rare than rare. So it's not as dangerous as hyperthyroidism. But we typically will give supplement called levothyroxine,
Mhm,
or
mhm, mhm,
basically giving yourself thyroid in order to work. So there are some medications out there that are natural supplements for the thyroid, but we found that sometimes we can't get the right control with those medications, so we lean towards the levothyroxine. But I do know of naturopath and other people who would prefer to try those supplements. But my suggestion, this is not medical advice. Nothing here is medical advice. But if
yeah.
someone were to do that, then I would just say make sure you're monitoring those levels and your symptoms to make sure that it's controlled.
Let me give a personal story. When I had my after I had my first child, I was trying to get pregnant for my second kid. My
Mm-hmm.
hair was so, I think I was losing hair, and my OBGYN, I mean, I had a natural, I mean, it was easy for me to get pregnant, but my second kid, it was a little bit
Yeah.
hard for me
Yeah.
to get pregnant. It was a little bit, it took a while. And she said, let's check your TSH. I'm like, come on, doc. I checked my TSH. Like, they checked it last year. I mean, it's going to be fine. I guess
Yeah.
what my TSH was, I think it was high. No, no,
Mm.
no, it was low. I can't remember. It's been a while. I think it was low. And she's like, we're going to start you on medication. But she checked my T3 and T4. They were normal. But she still placed me on medication. Why, though?
So
And guess
I
what?
don't
After
know.
she placed me on the medication,
Uh-huh.
the next month I got pregnant and my hair was back to normal. I'm like, okay, this must be something. This is a miracle. Like, I was on the medication throughout my pregnancy.
Yeah.
Then after my pregnancy, she kind of weaned me off of it.
So there is a place called subclinical hyperthyroid where you might not have as many symptoms, but there's still something off as far as like the chemistry and the levels. And so some people do many medications because there's still a risk to the heart. Like again, it's metabolism, our energy. It's a thyroid affects a lot of parts of our body, especially our heart is what we're looking at. And so some people do require medication, even if it seems like the numbers are just a little bit off. But that's like a conversation. That's like case by case as well.
So even in those cases, it's okay to administer medication, or just depends on the primary care doctor, what he's looking for, what he or she's looking at.
Yep,
Is that what you
exactly. It
said?
depends on the person. Yep,
Okay.
it depends.
So which is worse then, the high or low, the thyroid, or both of them are the same
So more critical hyperthyroid, but again, there's still effects with
with
hypothyroidism.
hypothyroidism? So either ways, you're having hair issues with both of them.
Yes, potentially for sure.
Potentially. Okay, got it. Got it. Got it. So could hair loss also be the only symptom? If you're, let's go by that. Could hair loss be the only symptom, or you are going to see other symptoms associated with hair loss?
Usually we'll see more symptoms, but potentially hair loss could be the only thing. But again, we'll go into more depth and ask more
Hmm.
questions. Because sometimes we don't even realize the symptoms that we have
Okay.
are symptoms. We're thinking, oh, this is just normal. This is what I'm used
Okay.
to. But when we have the conversation with a healthcare professional who knows what they're looking for, they're like, oh, no, something's a little bit, there's a little bit more to the story than just, oh, all I have is hair loss.
So are you saying that, let's assume now that the person comes to you suffering from hair loss and has other symptoms too, and you see they have their thyroid, they have some thyroid imbalance, and they're like, "Hey doc, I don't want to start any medication. I just want to go use mint green oil on my hair and fix my hair." Do you think there's a chance they're going to regain their hair without treating the underlying issue?
That's the hard part. The with with a lot with yeah with all disease, right? If there's an underlying condition that needs to be treated in order for the symptoms to improve,
So,
because that problem is still a problem. Whether you put a band-aid on it, there's still a wound, right? Like there's still a gaping wound, right? Whether you
yeah,
put a band-aid or something, you still have to address what
yeah,
is the underlying issue, so that you can have the optimal results. Like that's ultimately what we want, right? Optimal results and to get
yeah,
people to where they want to be. So it's we're gonna have to treat what's causing the issue.
got it. So let me put a disclaimer. I didn't say it. Dr. Williams said it. She's like, no matter what you use, if you don't fix that thyroid, not you're not going to see any improvement. She said
Yeah,
it, so you have to go to a clinic. I'm just saying what I'm just echoing what you said, so they will
that's
understand that
hilarious.
you said it. I didn't say. So when they come to my clinic and I say it, it's like no. So I want them to understand that you are saying it now that you have to take care of the issue. You can't put a
Yeah,
band-aid on a problem,
absolutely.
and that's it.
That's true.
Okay.
That's true for almost every. Yeah, that's true for everything.
Okay. So these thyroid issues, do you see it more in postmenopausal or premenopausal women, or it doesn't matter? Like anyone can have thyroid issues. Like it doesn't really matter.
Yeah, anyone can have thyroid issues, but we definitely see it in premenopausal, like our 20s, 30s, 40s, where we'll see
Mhm.
more again more women having thyroid disease compared to older.
Compared to older. Okay. So okay. And then is it associated, like, I mean, some people also have other medical problems like lupus and all that.
Yes.
Can they also see that are they also supposed to be concerned about thyroid issues? Or is just once they have this disease, lupus or some other disease going on that, then they can have thyroid problem,
Mm. One of the most common reasons for hypothyroidism is autoimmune diseases.
autoimmune
So,
disease?
yes, yeah. So it's still worth it, of course, to check the thyroid, even in the midst of having lupus and rheumatoid arthritis, because they could potentially have a comorbid condition, comorbid
Comorbid.
yes, thyroid disease. Yep.
So they can have two or three things going on at the same time.
Unfortunately,
Mm.
I know nobody.
So
Like we don't wish
they
that on
can have
anyone.
so they can have diabetes and still have their thyroid imbalance.
Right?
They
Exactly.
can have high blood pressure and still have thyroid problems. So that there's no excuse. You just have to check it if you have any symptoms that you've mentioned.
Exactly. Exactly.
So that's the point. So if
Yes.
you're having hair loss, let's say if you're having hair loss with constipation, you're losing weight. You're noticing no matter what you eat, you're losing weight.
Yes.
These are things you need to bring up to your doctor, talk to your doctor about. And if they ask you, hey, who told you about this? What have you been reading? Say, I learned it from Dr. Williams. She said it.
Lord have
I learned
mercy.
it.
Again, no medical advice.
It's not medical advice, but it's for them to be aware that
Aware,
there's
exactly.
something. Yeah, it's just awareness for them to. Is the right knowledge. We're just putting out the right knowledge.
Correct.
So when they know their doctor, they have to go to their doctor because they can't order it themselves. They have
Right,
to go to a
exactly.
doctor, a practitioner to order those tests, and they're going to have a sit down discussion. So, do you have any final words for us? Anything you have to tell us? Let us know. Tell us where your practice is one more time.
Yes,
We'll just
Gateway Direct Health, the best membership practice in South Atlanta. So we are in Henry County in Stockbridge,
okay.
but we're happy to help people and we're happy to work with your
Mm-hmm.
specialist so that we're giving all around
Awesome.
holistic care, right? So we will
Okay.
talk and we will discuss your case so you don't feel like, oh, I have to be the go between my specialist. You can see like we try to do things together and work together for our people.
Okay.
So yes, I'm happy to help. You can go to
Okay.
gatewaydirecthealth.com. You can email us at info@gatewaydirecthealth.com or give us a
Okay.
call at 404-941-1415.
She said it. Thank you so much, Dr. Williams. Thank you for
Of
your
course.
time. I just,
Thank you. Thank you. I appreciate you.
you're welcome. Thank you so much. Thank you so much. Okay. Um, thank you. Bye bye. Okay, guys. guys, we heard from Dr. Williams. She had to go, but we understand about the importance of thyroid hormones in relation to your hair loss. Sometimes, from what she said, sometimes hair loss might be the only subtle symptom you might have. Okay, if you're having hair shedding is when you're losing chunks of hair shedding, or when your hair is progressively thinning. Okay, so when people come to the clinic and meet me, especially if they're suffering from hair loss, the first question I ask them is, are you having progressive thinning leading to hair loss? Or your hair is shedding, which is you're seeing lots of hair in your comb when you comb it, or when you take a shower, you wash your hair. So these are the questions. If you say, hey, doc, I'm seeing lots of hair shedding, then I'm thinking about your thyroid. Okay, so this is the first question you need to know for every physician, for any hair loss person. This is a question how you ask when a client comes to you that I'm losing hair. First question, gradual, is it progressive or is something sudden? Okay, if it's something sudden that started, you need to think about the person's thyroid hormone because it's involved in balancing, okay, your metabolism is involved in balancing your metabolism. Like she told us, is the thyroid hormone, sorry to use that word, it can be bipolar. What does it mean of bipolar? It can be high, it can be low. It can be crazy, it can be depressed. Okay? So once you understand that hair loss can be associated with your thyroid, okay, then that is something you should let your doctor know. So I always encourage every lady, every man sometime, to always talk about their thyroid for their doctor to check it. If someone comes to me, I have to check your thyroid first, okay? Because it might be just a simple fix. It might just place you on thyroid hormone or something else is going on. So we have to fix that. Like she said, we don't want to put a band-aid on something that can be fixed. Okay? So it's easy, like I said, hypothyroidism when your thyroid hormone is low. Hyperthyroidism when your hormone is high. Okay? So either ways, it's going to affect your hair. So I don't want you to think just the hypo or the hypo. No. Either ways, it's going to affect your hair. It's going to cause hair loss. Because I know I have a personal story, which I already said. Okay, it happened years ago. I was losing hair and I was trying to get pregnant, and my OBGYN checked it. So, and placed me on thyroid hormones. And like I said, my hair came back and I got pregnant. So it's very important for us to check it. Okay. So if you have any questions, I want you to text us, DM us. Okay. Havila Hair Restoration. We do everything about hair loss, everything about hair loss. If you have questions, if you've seen anyone, if you've seen a trichologist, if you've seen a dermatologist, if you've seen anyone, if you've been dealing with hair loss, contact us, okay? See how we can help you. Okay, I get tons of questions. Reply tons of questions. So if you have any issues with hair, or if you're even on any medication, you think you're losing hair, you can contact us and we can go through your medication list. We do virtual consult and we do in-clinic consult, which is the best, the in-person consult or in-clinic consultation, hair consultation. But sometimes if you're out of state, we can do virtual consult. I have a lot of clients that do virtual consultation. Okay, so partner with us, Havila Hair Restoration. Check our website. And I'm going to be checking out here. I'm going to be logging off. If you have any questions, let me know. Bye-bye.